Okay, welcome. How would you help my patients?
I would help your patients by teaching them to speak more clearly, and any patients that have feeding difficulties, that could be patients with picky eating, limited diet repertoire, trouble transitioning to textures, feeding tube dependence, teaching them to helping them eat more, and traumatic brain injury patients, anything that was related to that as well, and voice disorders.
Lots of different things. This is fun. What tools would you use to evaluate the patient?
To evaluate the patients. So we have a number of different test protocols for certain patients. Other evaluations really usually take place in the natural environment so that I can observe meal times and observe oral motor function and disorders. Sometimes I have my little handy dandy tools. I have this little Nook brush here. I have a little special feeder spoon. So I can really get a good look at what's going on from a sensory perspective as well as an oral motor perspective.
Oh, I like that. And what ages do you see?
My practice sees children from birth all the way up to 18.
Okay, awesome. Well, welcome. What specialty could this be? Go ahead, Kristina.
I am a pediatric speech language pathologist specializing in feeding.
Awesome. Very appropriate for this month, which our topic is nutrition. So thank you so much for joining. I am going to do a little split screen video now here. Perfect. That way we're not going back and forth anymore. So today we wanted to talk a little bit about feeding therapy, and we wanted to separate it in ages and get Kristina's recommendations on what are some clues that we should be looking at, what should I be seeing in order to refer patients to you. So why don't we start with 0 to 2?
Sure. So from 0 to 2, it could be issues with nursing, bottle feeding. That could be feeding refusals. That could be discoordination, choking. It could be trouble. I'm also a lactation counselor, so it could be trouble. Like I said, it could be oral motor trouble sucking, as well as I said, feeding refusals. I see a lot of children with different GI symptoms. So a lot of times that manifests in feeding refusals, poor intake, poor weight gain, failure to thrive. And as you get into older infants and into like early toddlerhood, I see a lot of children with trouble transitioning to textures, refusing either spoon feeds or solid feeds, refusal to transition to different utensils, be that from a bottle to a cup, to different spoons, finger feeding, etc. And poor, like I think I said, poor intake, so trouble with weight gain and anything in between. Could be picky eating, textures, refusals.
Awesome. And how about for the teenagers and up?
Teenagers and up. So from young kids all the way through teenagers, we see a variety of things. We have children that are feeding tube dependent, trying to wean them off of feeding tubes, and more toward oral intake. Kids with picky eating, extreme picky eating, which obviously can affect their nutrition, severely limited diets. As well as oral motor dysfunction and disorders, trying to teach them, be it how to chew, different oral patterns. Some children, for example, with tongue thrust issues, and teaching them new oral patterns to get a more functional chew. And it could be kids with excessive drooling. We work with kids as they get older sometimes who have various disorders. If you have children with different conditions that might affect muscles, for example, cerebral palsy, we might work with them on improved oral control and try to advance their diet as appropriate, of course.
Okay. Awesome. Yeah, lots of good stuff. I will say I'd like to end with one other question, which is a lot of times, especially around the 3 to 5 year range, I get a lot of parents with concerns that their child is picky. And this could be a completely normal child who's just picky about eating, or the parents get really stressed about that. So let's say medically they're completely healthy, would there be any benefits for those kids having feeding therapy if they don't have any medical conditions per se that would be the reason of their pickiness?
Mm-hmm. Absolutely. And I think it depends on to what degree their pickiness is affecting the family. This is a question I get a lot from parents, and it's something I hear often, and it's often well-intended family members and such that kind of give the old advice. It's kind of like, oh, if they get hungry enough, they'll eat. Which I think can be very difficult for parents to hear, because it can feel a little minimizing for their feelings. I think feeding especially is a really stressful issue for families because it's something families are facing all day, every single day. It's not just a one and done issue. And so I really think it comes down to how much is it affecting your lifestyle as well as the child's nutrition, of course. So if they're having a severe limited diet and it's impacting either calorically, and they're otherwise healthy, but calorically, or they're missing major food groups that could impact nutrition, obviously then it becomes a concern. Or if families aren't able to go places or do things and their lifestyle is restricted because their child is so regimented and so picky, whether that's brand specific, whether it's they only eat certain foods that the parents can't pack with them so they can't go on a trip, whatever that is, if it's really impacting their lifestyle, not to mention from a stress perspective, because it is so stressful, we really can come in there and make the whole mealtime experience not just a more positive experience for the child and widen their horizons and widen the variety of foods that they take, but really try to work with the whole family on de-stressing that experience and making the association with mealtime and eating much more positive overall.
Okay. No, yeah, that sounds great. I will say sometimes some families I'll revert to just wait and see and let them starve for a little bit. And then they'll pick up and it works. But I will say definitely most commonly, there's a lot of stress involved. So that's great to know that there are things that they can be doing and therapies that we can be referring them to that will help with that and bring down those stress levels.
For sure. And there are certainly kids who have, where that works for, that let's say they have no other issues, especially through toddlerhood and stuff, when they're just looking for that control and they can come in phases, like they were a great eater and then all of a sudden they're just digging their heels in. Not as much of a concern. I do really try to right, exactly. The easiest way for them to exert that control. So I do really try to be there for parents. I have parents call me a lot, even as like an initial screener where I'm like, well, try this and this. And if this isn't working in a few weeks, call me back. So that, because not every child's going to, really has a disorder of feeding. Yeah. But I try to help parents weed out when is it really a concern versus a developmental phase.
Perfect. I like that. So I know usually I would refer patients to you and we have some pretty good ways of doing that. But if there's any other family that wants to reach out, how can they get a hold of you? What other services do you provide? Tell us a little bit more about that.
Absolutely. So I kind of do everything, including admin for the company, and I run the caseload and I do every evaluation myself because I like to get to know patients and families. And I have several therapists that are amazing that work for me. So I am the best point of contact. So my company is Madden Therapy Solutions, MADDEN, and my phone number is 727-240-6209. Or my email is Kristina, Kristina, at maddentherapysolutions.com. And we offer speech therapy, feeding therapy, lactation counseling, nutrition, both for pediatric and for mamas, for pre and postnatal. And we also do pediatric sleep consulting now. So that's an exciting new service we just started as well.
Can't wait to send you some patients for that too. Well,
absolutely.
Thank
Talk
you.
about feeding is stressful. No sleep is stressful.
That's going to be a different month topic. Okay, well, thank you everybody for tuning in today. Contact Kristina or contact me if you have any questions. And we'll see you guys next time with our next Guess Who game. Bye.
Thank you for having me.
Okay, so this is what we're really meeting up for. So, how to make coquito.
How to make coquito. What goes on behind the scenes?
Okay. Coconut milk.
Okay.
And coconut cream.
Both.
Yes.
Okay.
For the spices, cinnamon, anise, clove, and vanilla extract.
Okay.
And then you add Bacardi.
Okay.
And then the Bacardi, you add however much you want.
Okay.
Depending on how heavy you want to make it.
Okay. Okay. Awesome.
And that's really
godsend.
okay.
The real work.